Pregnancy Wonders 3D, an educational channel about reproductive health and pregnancy. Subscribe to explore medicine with us and write in the comments what else you'd like to learn.
Every year, over 300,000 Americans and 35,000 Canadians spend between $15,000 to $30,000 per IVF cycle, hoping to start a family. But what exactly happens to your body during this expensive medical procedure? Today, we'll use detailed 3D animations to show you the complete IVF process from start to finish. The numbers are staggering. In the United States, the average cost of one IVF cycle ranges from $15,000 to $30,000, including medications and genetic testing. In Canada, costs are lower at CAD. $7,700 to $11,100, roughly $5,500 to $8,000 USD, plus medication costs of CAD $2,000 to $6,000. Some Canadian provinces offer partial government funding for one cycle. But here's what most couples don't realize: IVF success rates vary dramatically by age and clinic quality. For women under 35, success rates can reach 60% per cycle at top clinics, but drop to just 7% for women over 42. Phase 1: Ovarian Stimulation. Our 3D animation shows how fertility drugs like Gonal-f, Follistim, and Minopa work at the cellular level. These medications contain follicle-stimulating hormone, or FSH, which tricks your ovaries into producing multiple eggs, instead of the usual single egg per month. During this 8 to 14-day process, you'll inject these hormones daily, costing $3,000 to $5,000 per cycle in the US and CAD, $2,000 to $6,000 in Canada. The drugs cause your ovarian follicles to grow rapidly, as shown in our detailed 3D visualization. Each follicle contains one egg, and the goal is to develop 10 to 20 mature follicles simultaneously. Your doctor monitors this process through frequent blood tests and ultrasounds, checking estrogen levels and measuring follicle size. When follicles reach 18 to 20 millimeters in diameter, you'll receive a trigger shot of human chorionic gonadotropin, or-HCG, which causes final egg maturation. Phase 2: Egg Retrieval. Next comes egg retrieval, a surgical procedure performed under sedation. Our 3D animation demonstrates how a thin needle is inserted through the vaginal wall into each ovarian follicle. The procedure typically takes 20 to 30 minutes, and doctors can retrieve 8 to 15 eggs on average. Here's where your $15,000 investment becomes critical. Not all retrieved eggs will be viable. Approximately 70 to 80% of eggs will be mature enough for fertilization. Of those, only 60 to 70% will successfully fertilize when combined with sperm. Phase 3: Fertilization. The fertilization process happens in the laboratory, as shown in our detailed 3D visualization. Embryologists examine each egg under high-powered microscopes, selecting only the healthiest specimens. For standard IVF, about 50,000 to 100,000 sperm are placed with each egg in a culture dish. For couples with male factor infertility, intracytoplasmic sperm injection, or ACSI, is used. This procedure, which adds $1,500 to $2,500 to your bill in the US, involves injecting a single sperm directly into each egg using a microscopic needle, as demonstrated in our 3D animation. Phase 4: Embryo Development. After fertilization, embryos develop in specialized incubators that maintain precise temperature, humidity, and gas concentrations. Our animation shows how embryos progress from single cells to blastocysts over 5 to 6 days. Only 30 to 50% of fertilized eggs will develop into high-quality blastocysts suitable for transfer. Many clinics now offer pre-implantation genetic testing, or PGT, which costs an additional $3,000 to $5,000. In the US, this process involves removing a few cells from each blastocyst and analyzing them for chromosomal abnormalities. Our 3D visualization shows how this biopsy is performed without damaging the embryo. Phase 5. Embryo transfer. The embryo transfer procedure is surprisingly simple compared to the complexity of previous steps. Using ultrasound guidance, doctors insert a thin catheter through the cervix and deposit 1 or 2 embryos into the uterine cavity. The entire process takes just a few minutes and requires no anesthesia. However, this is where the emotional and financial stress intensifies. The 2-week wait between transfer and pregnancy. TESD is agonizing for couples who have invested thousands of dollars and months of preparation. During this time, progesterone supplements support the uterine lining, as shown in our 3D animation of hormone action at the cellular level. The financial reality. For couples facing multiple failed cycles, the financial burden becomes overwhelming. The average couple undergoes 2.5 cycles before achieving a live birth, meaning total costs often exceed $40,000 in the US and CAD, $30,000 in Canada. Insurance coverage remains inconsistent. While some US states mandate fertility coverage, many policies exclude IVF entirely. In Canada, Quebec provides the most comprehensive coverage, while other provinces offer limited support. Hope for the future. Recent advances offer hope for improving success rates while reducing costs. Time-lapse embryo monitoring, artificial intelligence for embryo selection, and improved freezing techniques are revolutionizing the field. Our 3D animations demonstrate how these technologies work at the molecular level. Understanding exactly what happens during your $15,000 IVF cycle empowers you to make informed decisions about your fertility journey. If this detailed explanation helped clarify the complex IVF process, subscribe for more 3D medical animations that break down expensive medical procedures. Important medical disclaimer: this content is for educational purposes only and should not be considered medical advice. Always consult with qualified healthcare professionals for personalized medical guidance regarding fertility treatments and reproductive health decisions.